I'd like to welcome you all to this session of the Socio-Economics of Pandemic Policy. And we are truly privileged to have such a wonderful panel to discuss this really critically important issue. Let me just say a few words about the issue at hand. We tend, in terms of health policy, to think in terms of silos, and that is dangerous beyond belief. Health is seen mainly as a matter of treatment of disease, and it's divorced of other policies, economic policies, environmental policies, and that has terrible consequences, because all these policies are interconnected. And even though we may be doing a limited amount of good in health policy, if we then do harm in our environmental and economic policy, we are clearly in a self-defeating process. And that is where we are today. And the purpose of this session is to gain some insights and concrete policy proposals as to how this big policy problem can be overcome. I think the best way to start out is to set the scene, which is stating the obvious. We live on one planet. Within this one planet, human beings are interconnected beyond our wildest imagination and beliefs through the processes of globalization, through telecommunications and digitalization. And within this broad domain of social interconnections, we have a subdomain of politics, policymaking, which allocates power across different agents. And within that big subdomain, we've got the subdomain of economics, in which the flow of resources and goods and services is allocated and distributed. And we tend to see these things as isolated, but they're all interconnected because the economy and the polity is within the society, which is within the environment. And therefore, to look at things in terms of, there was a formula that Detlef Ganten had in one of his books called the Gesundheitsformel, the health formula, where he says that health, it depends on three things. It depends on biology, which is not just treatment of disease, but health generally, that includes prevention. It also includes institutions, international cooperation that is required for health policy to promote biology. And then beyond that, there is the environment, which is the social, political, natural environment, everything that goes into human well-being. And then the third element is behavior, which is norms and values, our identities that clearly have a very important bearing on our health. People whose identities are tied to a libertarian understanding of human agency that makes vaccinations not contemplatable, that has huge impacts on health policy. So all these different domains, biology, environment, and behavior, are determinants of health. And now the challenge of this particular session is to see things from a holistic perspective, to bring the natural environment, the political, economic, and social to bear on the health policy and see what it means for health policy to be a focus across these domains. And you can see beyond anything that the panelists will tell us, that this has huge implications for our thinking, because we know from the news media, day after day, night after night, that there is supposedly a conflict between economic policy and health policy. The economic policymakers want to open the economy up, and that creates health risks, and then the health policymakers want to close it down. And we have to stop this nonsense. We have to think in terms of human well-being, the well-being of individuals in thriving societies, and see how health policy and economic policy and environmental policy feed into this. And so we have a wonderful panel that extends across the political, NGO, academic, scientific, and technological domains. And I'll do it in terms of order of speaking. Each of the speakers will have 3 to 5 minutes to make an opening statement, and then I will start a discussion. And I hope you don't mind. I have the irritating habit of interrupting people when they go on to a long monologue and make sure the conversation flows. So to start out with, we will have Gabriela Ramos, who is the Assistant Director General for Social and Human Sciences at UNESCO. And she oversees the contributions of UNESCO to build inclusive and peaceful societies. It's a terribly central domain, social inclusion, gender equality, ethics of AI, lots of progress made very recently. She's a member of the Lancet Commission. Before her current job, she was Chief of Staff and Sherpa of the G20, G7, and APEC in the OECD. And within the OECD, she played a dominant role in leading new approaches to economic challenges. She initiated the Inclusive Growth Initiative, the gender strategy, the well-being framework. She is uniquely well-suited for this panel, and I'm so delighted that we were able to get her. Then Alan Donnelly on my left, convener of the G20 Health and Development Partnership, executive chairman of Sovereign Sustainability and Development. He was a member of the European Parliament for 11 years, including 2 years as a period as leader of the Labour Party in Europe. And he brings some wonderful political perspective, not only on the level of top-down governance, but multi-level governance to the issues at hand. And then we have Dr. Tolula Oni, and she is a senior research medical officer at the University of Cambridge. She is the joint lead of the Global Diet and Activity Research Group at the University of Cambridge. She is founder and principal of Urban Better, a public health physician and urban epidemiologist, fellow of the African Academy of Sciences, et cetera, et cetera, et cetera. In fact, the et cetera, refers to each of the candidates, but for the sake of brevity, I won't repeat it each time. And then on my right is Nicola Bashu. He's president of the Grand Paris Alliance for Metropolitan Development and fellow of the Global Solutions Initiative, among many other things. He's the director of the Renaissance Urbaine. He has just put out recently an exciting book called Intersecting, which shows how urban and infrastructure more generally, is at the intersection of many critical problems, including those of health. And therefore, from that perspective, a wonderful person to have on this panel. And then we have Tanya Bricker, who is Vice President of Hologic, Vice President of Strategic Development for Breast, Skeletal, and Surgical Solutions at Hologic. She has degrees in nursing and marketing, an expert in the medical device industry. Wonderful to have you on board from that particular perspective. Right, now, with these introductions done with, let me hand over to you, Gabriela. If you could give your opening remarks, and we very much look forward to you pulling the whole thing together on the basis of your vast experience.
Well, I will not dare to do so, Dennis, but I will try to make a contribution to these very important discussions that you're bringing forward. And I would have loved to be with you, but anyway, it was impossible for me to be there. Let's start off where we are. The legacies of the crisis are huge, not only in terms of the impact in the economic prospects of our economies, but also, I mean, first and foremost, the loss of life, 5 million, the loss of jobs, millions too, the loss of prospects, 100 or more million people falling into poverty. And I don't need to tell you about the increase in inequalities of income, opportunities, of access, of social protection, and the societal changes that Dennis has just spoken. The fact that this has been an uneven crisis with some groups, some countries carrying the bulk of it, some others benefiting in somewhat a more flexible way of working. And at the center, of course, the impact on women that had to not only fight the virus, but also face violence at home and had to keep on the school going with the closure. So the lesson, as Dennis said, is clear. We were not prepared for this crisis, and therefore the real question here, are we going to be well prepared to coming out and learn the lessons from this? And this is the call that I would say. Health is not just a health system. It really is driven by many elements. 85% of health determinants are not related to the health system per se, but are related to all the other socioeconomic and specific contexts in which people live. The health systems, as we built them before, we saw it based on efficiency, cost benefit, reduction of additional margins of maneuver, really didn't position well in this context. It is therefore crucial that governments around the world take the opportunity to rebuild the economies and redo what I would say the most important element in the whole debate, which is a more solid social contract. This goes by putting equity and sustainability a la par with efficiency and going beyond GDP. This is a massive undertaking because it will require us to do a total re-engineering of the governments, get away from silos, and really bring a better understanding of complex systems. Of course, people need to take decisions. Of course, we need to simplify those decisions. But the reality is that the growth model that we have built, focused on GDP and GDP per capita, has just maximized production, consumption, and left behind the question of well-being, as I said, but also the question of solidarity, of equality, and how do we live together. My main point, as you ask us, Dennis, will be that we need to reinvest in government capacities. The challenges we're facing, not only from the analytical tools, but also in terms of who are in the governments, who takes the decisions, how do we make sure that they have the best tools to deliver for good in terms of understanding this intersection of the different systems, but also how do we do it in a way that is ahead of the game, that help us anticipate, and that would also deliver much better in which we are. As you mentioned, I'm dealing with the ethics of artificial intelligence. Today, all of the newspapers are saying that not even the creators of some of the algorithms of Facebook knew what was going on. I really think we need to go back again and ensure that the governments have the capacities to take the best decisions and also to deliver better for people.
Thank you very much, Gabriela, for this epic introduction. I'd now like to turn over to you, Alan. You're well placed to carry on the discussion here because you've done some serious thinking on common metrics for assessing the return on investment, building capacity for vaccines, therapeutics, and diagnostics, and looking at this government capacity that Gabriela has talked about from a wider perspective, from micro to macro. Let's hear your thoughts.
Well, Dennis, thanks very much for the opportunity to speak, and it's great to see Gabriela. I saw her in her previous role when she was at the OECD. I hope you're well, and you did a fantastic job there as the Sherpa for the G20 and the G7. Dennis, I want to be very concrete today because the World Health Summit, I think, has been a fantastic event. And we have had some very interesting discussions about the way in which we move forward out of this particular crisis. But it's incredibly important that we understand that on Friday of this week, there will be a joint meeting of health and finance ministers in the G20, representing 80% of the world economy. On Saturday and Sunday, there will be the heads of government meeting in Rome of the G20. And then, of course, next week, we will have the start of COP26. The first thing I want to say to you is I'm utterly appalled that there is no proper session at COP26 on the link between health and the environment. I know there are going to be some side events, but the link between climate change and health is so obvious. It is frankly shocking to me that that neither the British government nor the Italians, who are jointly hosting this, have not got a major session with Dr. Tedros and others speaking at it, looking at the link between health and climate change. And I really hope that can be changed before COP26 starts. But I want to focus on the G20 meeting because I chair the G20 Health and Development Partnership, which is a not-for-profit organization, and I've had the chance to speak to many of the finance ministers and health ministers over the course of the last few months. When we had the economic crisis in 2008 and 2009, the banking crisis, there was a London summit convened. There was a very short communique which created a funding mechanism to stop the economy going into recession. It created the Financial Stability Board to make sure that the banking crisis was arrested. It brought finance ministers and central bank governors together, and there was new rules and regulations to ensure capital adequacy and the resilience of the banking system. We face exactly the same crisis today in terms of public health. And this weekend, we need a similar initiative. And Mr. Draghi, a former central bank governor, who's now the Prime Minister of Italy, should address this in the same way that the London summit addressed the 2008-2009 economic crisis. And that means that we need, first of all, a strengthened World Health Organization. We can't operate on the basis that the World Health Organization has a budget less than a major hospital in Houston, Texas. We need to make sure that it's properly funded. We need a financing mechanism to take us out of the current public health crisis that we've got, because we need to build resilience in our health system. We need a new pandemic board, the equivalent of the Financial Stability Board, that will manage that budget, and that can also be alert to a new pathogen and a new threat to humanity. And then finally, we need a new multilateral surveillance procedure using the best data, the best technology, which exists. It exists in the world today. We can't be doing what we've done in the last 18 months, where we didn't have proper information on testing, on diagnosis, because we weren't able to measure the scale of the crisis. And as a result, the response was very, very poor. So I think that this weekend, it's an opportunity, and we in the G20 Health and Development Partnership have been speaking to health ministers and finance ministers, and we will speak to some of the heads of government. We need a new multilateral surveillance procedure, a new financing mechanism, a new board that will manage pandemic risk and the finance associated with it, and a strengthening of the World Health Organization. But I want to mention one other initiative that we will pursue ourselves within this partnership. Dennis, before I went into politics, I used to be a national trade union official. And in many countries around the world, the social partners play a very important and institutional role in the way their economy operates. In France and Germany and so forth, the social partners, the employers and the trade unions work very closely on existential threats to the economy. We will launch an initiative in the coming weeks where we will bring employers and trade unions together to assess the way in which governments are looking at public health. As Gabriela said, we've had massive unemployment, we've had deaths, we've had businesses go out of business, and that will never come back. And we will take an initiative, and we'll take it into the German presidency of the G7 and the Indonesian presidency of the G20 and the French presidency of the EU next year to get social partners together so that we start getting pressure from workers, from employees and employers to get a better response to this crisis. The final thing, very quickly, is we've finally got finance ministers and health ministers to change their narrative. They do now talk about investing in health instead of spending on health. And had they have invested in health prior to this pandemic, we wouldn't have had to use probably now about $12 trillion to mitigate the pandemic. That's, I think, where the figure stands at the moment, $12 trillion. If we'd invested the 300 or 400 billion we needed, we wouldn't face the crisis we have today. And so we have worked with the WIFO Institute here in Germany and with Harvard University to create a set of common metrics to help governments measure the return on investment and the return on value. Germany uses those measurements already. Mexico uses them. Chile uses them. And what we want is for governments to start looking at what the return on investment is when they spend on health, because it is an investment. It creates jobs and it creates sustainable growth in the economy, and it keeps our people safe.
Thanks very much. This advances things in exactly the direction I was hoping in this panel, because one of the critical issues is how do we succeed, as Gabriela said, of measuring performance beyond GDP and shareholder value. And at the Global Solutions Initiative, we've got a worldwide initiative that looks at measuring performance across 4 important domains. One is solidarity, which means social inclusion and cohesion, embeddedness within society, thriving societies. The other is agency, which is personal empowerment, the ability to affect your own future through your own efforts. Then there's material gain, which is all the stuff that economists focus on, GDP per capita, its distribution, and so on. And finally is environmental performance. So solidarity, agency, material gain, and environmental performance, SAGE, is the SAGE framework. And we're put together an international working group that will measure elements of performance in a very disaggregated way across these 4 headline figures. And we'd love to link up with you. And that will, in fact, be one of the common threads here, because all of us in different ways are engaged in measuring things. And if we can bring these measures together to good effect and communicate to the public that it's high time to focus on the well-being of people rather than the well-being of economies, that economies are here to serve society, not vice versa, then we'll have done a very big job. Beyond that, of course, comes reporting, there comes governance issues, there come incentives, and lots of things in terms of government policy that Gabriela was talking about, increasing government capacity, focusing on multi-level governance so that the micro political units are acting in consonance with the macro units. Now, that brings us to our next participant, Tulula Oni, who has focused on another aspect of this, which is, among many other things, health within cities. and looking at not just access to health infrastructure, but access to social infrastructure, including public space, digital connectivity, and so forth. Tulula, if you could give us a rundown of your activities in this regard.
Thank you, Dennis. And just, I think my points build on very well from the previous two speakers. So I come at this from public health medicine and urban epidemiology, and been reflecting certainly for a while, but even more acutely in the last couple of years on that intersection, and largely what's been playing out as disconnect between health, environment, and the economy. And reflecting on this, I would say that there's at least three things that we've learned, quote unquote, in the last couple of years that we essentially knew already. The first is that access to social infrastructure informs health outcomes. So Gabriella earlier mentioned that we know that 85%, at least 85% of factors that influence health lies are the healthcare sector. Even in public health, we say that, and then we say, well, what do we do about health? And then we look at the healthcare sector, because it's a much more concrete, it's very direct. You know, you can see the link between exposure to a disease and an outcome. We feel like we're doing something. Obviously, access to healthcare, absolutely critical. But we know that the quality of your housing, we know that your access to public space. There was a session yesterday on the launch of the Lancet Commission on governing health futures, on digital futures and digital connectivity. We've seen all this play out in the context of the pandemic. So we've seen quite a significant in the UK, a significant, certainly in the first wave, proportion of transmission was going on within households. So when you have households that are overcrowded with poor ventilation, you have inequality with respect to exposure. When you have insufficient social net in terms of sick pay, etc., you have greater exposure. You're more likely to go to work sick. You know, it's all well and good to say stay at home if you're feeling unwell. It's like, well, that's not really relevant. Is as relevant as go exercise outdoors when there's no infrastructure for walking or cycling, and you risk injury to do so. So we've almost been treating public health like people exist in a social vacuum, which we know that not to be true. The second aspect second point that we learned or relearned anew is that leadership from government plays a critical role in coordinating coherent responses when we're dealing with complex societal health challenges. So what we've seen pan out in the context of the pandemic is, you know, where we were before in thinking about health as a healthcare issue or health sector issue. If that were true, if that were borne out, then the ministries of health would have been responsible for the pandemic and everyone else would go about their business, right? That's not the case, because we know that health is inherently political and is inherently multisectoral. And so any efforts to inaction is in and of itself a political statement. Related to the political is the critical role that trust and legitimacy play in health resilience. So we knew before the pandemic, the rankings of preparedness for a pandemic in terms of the index showed that the US, the UK, European countries are higher up, the very countries that didn't do well, because we didn't factor in things like trust in government, we didn't factor things like social cohesion, we didn't factor in things like inequality, and we see that play out as really critical. And I'll come onto that as I close. And the last point as really critical is that resilience is not just reactive. I get very irritated by the word resilience sometimes, because particularly in the context of preventable surprises, right? When we talk about issues where we know what's coming and we know what can be done about it, let's not talk about resilience as if it's something that we just have to react to. Actually, we see that with COVID, increased risk of transmission of severe disease with pre-existing conditions, with exposure to air pollution, with poor access to healthcare. resilience is not something to be celebrated in that context, because there are things that we could do before this to actually reduce the risk of people being unwell and of people dying from really just a preventable surprise. So really acting on these lessons, we need to confront those contradictions, of those conflicting paradigms. I just want to end with something that I think hasn't got enough attention. And a colleague in the previous session and the planetary health session mentioned the WHO has a manifesto for manifesto prescription for a healthy recovery, which I thought was really simple and really elegant, with 6 steps with clear actions to protect nature. And I just want to highlight one of the prescriptions, which was building healthy, livable cities. If you're thinking about integrating health into urban planning, walking and cycling infrastructure, inclusive public space that's also resilient to climate change, building homes that are disease resistant, right? So that's with respect to transmission, with respect to injury risk. There was a study done a few years ago in Wales where they looked at upgrading social housing infrastructure, and they found that those that were exposed to the package of social of upgrades to the housing had a reduced admissions to emergency by 40% over 10 years. We managed to reduce hospital admissions by 40%. If we had a pill, if we had a vaccine to do that, we would be peddling it widely. This is from housing. So I get very, very animated because these are preventable surprises. So what if instead, contribution to health became the primary performance indicator of urban infrastructure development, right? So what if we measure your success by how much healthy foods environments you've created? What if incentives were aligned with disease burden that is attributable to the different sectors, so manufacturing, transport to trade? So what if the incentives were aligned to look at how much you've supported active travel and reduced air pollution? These are the kinds of things that we need to start thinking about. And I would end with 2 things. One, a Marshall Plan for planetary health. And this feeds on your point, Alan, in terms of thinking about recovery. We did that post the Second World War when we're looking at recovering in different countries. We have to be deliberate. We don't about how we recover. And I would argue a deliberate, from a top-down perspective, Marshall Plan for planetary health is really critical. And the second is an eco-social contract. And this is a bottom-up, thinking about the everyday people cuts across society. How do we actually go into a different kind of societal contract with each other to say that what are our priorities for being on this planet? What do we envisage? How do we work together, and how do we hold each other accountable for a healthy and increasingly urban future? So I'll end there. Thank you.
Thanks very much, Tallulah. This is really exciting. And you mentioned the WHO manifesto on healthy recovery from COVID-19. And one important issue with regards to healthy cities that you were focused on. But it's useful to also consider what the other 5 elements of that manifesto were, because given that they arise from the World Health Organization, you would have expected something that is very siloed, health specific, and actually it goes in quite a different direction. So the first one was protect and preserve the source of human health, which is nature. And that means biodiversity. We need to think about climate change, obviously intimately related to health, as well as sanitation, air pollution, chemicals, and so on. Second is invest in essential services, from water to sanitation to clean energy to healthcare facilities. So extending across various government silos. Third is ensure a quick and healthy energy transition. The International Energy Association has put out a really interesting report recently on how to achieve this transition, requiring it's all doable, but it requires very significant international cooperation, which is currently not in the cards. Fourthly, promote healthy and sustainable food systems, which we are lacking as well. Then there's building healthy and livable cities, to which you, Tallulah, have focused on. And finally is stop using taxpayers' money to fund pollution. Seems like a very strong, important point. There's huge amounts that are going into basically antisocial subsidies. So thinking along these lines will help us to think in terms of policy proposals. One thing that Tallulah highlighted is that we must be aware that our actions are highly context specific. They are taken within the context of our urban and rural environments. They're taken in the context of our natural human capital and natural capital. And so context is really important. If you are living in unhealthy buildings, as Tallulah alluded to, then you will naturally have unhealthy behaviors. And so very few people have thought more deeply about how context affects the nature of our activities than Nicola has. Nicola, I'd love you to bring your experience as well as the insights from your recent book to bear on the policy discussion we have here.
Thank you. Thank you very much, Dennis, and delighted to share a few thoughts about this issue. I would say that it had to be a pandemic like the COVID-19 one, and over 2 trillion of emergency investments recovery package to understand that we were going in wrong direction. Right? In the last decade, so little has been invested sometimes in social infrastructure. Right? As a global response from the 2008 crisis, systemic underinvestment in social infrastructure has been taking place. And while the world was urbanizing, this question of urbanization, cities, etc., has been consistently disregarded by governments all over the world. It's an elephant in the room when you're talking about climate, when you're talking about biodiversity and resources, when you're talking about health. But that's just, it was not just there when the new urban agenda was coined and voted by the United Nations in 2016. Such an issue as the risks of infectious diseases and pandemics was not just there. So the only real document we could use, like globally, right, regarding urbanization and cities, is completely silent about one of the greatest problem humanity has had to face, maybe since the Spanish flu war, etc. Right? And wherever you go, as you were saying, Dennis, and here we are in Berlin, we are living in and with these urban environments. In the past decade, or since the turn of the millennium, there has been this consciousness, yes, we are going more urban than rural, etc. But then it was all about networks and connecting cities. What we completely missed, likewise, is that infrastructure systems that were being built and invested in, and this is not billions, this is trillions, right, are interconnecting not just cities, but urban agglomerations, urban systems, regional development corridors, sometimes without the appropriate level of government, but they have been shaping the sort of urban industrial context that we are living in, right? And investments that went with that, consuming resources, emitting carbon, and so on. And in that sense, somehow the COVID-19 crisis plays the role of a hurt, painful wake-up call, right? And I'm struck that it has to take an amount of 12, maybe $15 trillion to start getting a sense that we should not forget about those elements why we are thinking about post-pandemic and forging responses to recover from the pandemic. Then the issue that comes immediately afterwards is, do we have good examples? How can we move forward without forgetting such lessons? I would say, and Tolu mentioned that somehow we have largely taken health as granted. If you look at any development in the past decade throughout Europe, the US, etc., you will have sustainability features, right? Greenery, etc. But the way that, for example, in Europe, in London, in Paris, in Berlin, at the end of the 19th century, right, a number of deep social policies were coined out of the fact that living in the city was definitely a problem. It was creating health problems, especially through water system, the lack of energy, a lack of proper waste management, etc. We have forgotten about that, right? And our interconnected urban systems have greatly contributed somehow to a very, very rapid spread out of the pandemic without the level of preparedness that should have gone with establishing more and more intense layers of connections. So very, very briefly, I don't want to be too long, but there are thousands of very relevant examples at community level in India or in Indonesia, at urban and city level in the global south. I'm thinking here about the resilience plan of Milano, which greatly helped Milano cope with the crisis. You've got examples of crisis municipalism developed as new policies, such as in Izmir in Turkey. We could list like dozens and hundreds of examples. The question now is, this does not help with strengthening policy abilities, with shaping leverage that can build on the conclusions that we do have strong infrastructure systems, we do have urban livelihoods, urbanization is continuing, but we were not prepared, and we are still not prepared to cope with the social and socio-economic consequences of the pandemic in the global urban context that we have collectively designed, invested in, and lived with in the past decade. In terms of solutions, I would say one way would be really to consider that investments in infrastructure should privilege not just infrastructure rational by and with infrastructure finance and infrastructure finance institutions, etc., but the end goal of infrastructure about building a new sustainable economy, reinvesting into interconnected digital, social, physical, economical infrastructure. That's one issue, and it is coming up in the G20, although the last meeting of the G20 finance ministers in DC has been a little bit probably shy about that. Another way would be, since there is this lack of accountability framework and solid agreement about what urbanization or cities could be in the future, this proposal of a G20 pact on sustainable urbanization that the T20, the group of think tanks of the G20, has been very intensely supporting this year, is gaining traction and could also be something that could be worked on with the friends and colleagues during the T20, G20 Indonesia and the G7 presidency of Germany. And the last but not least is we need to continue understanding those intersections. It's not just interdisciplinary or not thinking about silos, but really be able individually and collectively to intersect disease, health, society, system, solutions, agendas, informality, prosperity, communities, and make something out of that, right? So here is something that you can see. This is intersecting the book that was incubated by the Global Solutions Initiative. And this is only the beginning of a process. So I'm both quite pessimistic about what we have done, but I'm also quite optimistic about the array of solutions that we can coin out and deliver together.
Thanks very much, Nicola. We are all in this panel driving in the same direction. And whether you call it intersecting, as you have done, or in global solutions, recoupling economic and social prosperity, whether it's inclusive growth that Gabriela has championed. There are a number of elements that come together. And one really important one will be the element on measurement. And there, I think you, Tanya, have really an important insight. Measuring what matters and identifying what matters most is really important. We have looked at the urban-rural divide. We have looked at the need to include social partners and all those who are affected by policies to be involved in their formulation. One thing that we need to look at very badly is the gender divide. Most probably the most significant advance we can make in health is by focusing on women's health. And you, Tanya, have done a lot in that regard, and please regale us.
Yes, certainly. Thank you. And thank you very much for the opportunity to speak today on this panel. I've listened with great interest, and there's enormous overlap with the previous speakers. My comments today are really coming from my executive role with Hologic, which you've noted is a medical device company that particularly focuses on breast and cancer diagnostic screening, but also as my role previously as a registered nurse and midwife. And so combining that experience, I would love to be able to share with you some insights about a new survey that has been launched in the past month and here in Europe this week at this summit. Underpinning that, or before I go there, I just want to make one particular statement that one critical success factor for rebuilding a more sustainable future economy and societies is a more equitable distribution of government interventions and policy attention. Populations that have been marginalised or have received relatively disproportionate attention now have a window of opportunity to be recognised and to have more focus applied. Women are definitely one of those populations, and there's an opportunity right now for women's health to emerge with greater focus post-pandemic. However, few countries have dedicated women's health policies, and even fewer governments have direct and measurable data upon which they can measure where and how they need to make improvements. Women's health is global health and the cornerstone of families, communities, societies, and economies. Improving women's health means improving families, economies, societies. It's a positive and virtuous cycle if we can focus on how we can measure it. As I mentioned, this new global survey, which has just been launched, is here to document the current status of women's health and how we can identify areas for improvement and measure that over time and by country. The survey is called the Hologic Global Women's Health Index, and in partnership with Gallup, who has assisted us with the data gathering and metrics, analysis and synopsis by country. It's the first survey globally that draws from women's perspectives. It provides a baseline from which we can measure not only the state of women's health right now, but most importantly, determine the priorities, because amongst all of the other speakers, there's many we can do, but we need to determine what matters most and how we can impact women's health most effectively, immediately and over the years to come. Just to give you some stats, the index represents the lives and the input of 2.5 billion women and girls across the country, across the globe. Through this survey, 120,000 men and women and girls were spoken to across 116 different countries, and it was captured in 140 different languages. All of that is important in order to represent the reality of women and girls in the countries and the cultures of our globe. Importantly, what the index did was it examined 5 dimensions which represent 80% of a woman's life expectancy at birth. 80%. And that is, those 5 dimensions are basic health or basic needs like housing and food, individual health, emotional health, access to preventative care, and their perceptions on not only their safety, but their general health, such as general and maternal health. One of the survey findings from this year's inaugural output was that 1.5 billion women did not get tested for 1 or 4 of the leading causes of ill health for women, that is cardiovascular disease or high blood pressure, cancer, diabetes, and sexually transmitted infections or diseases. This Global Women's Health Index is intended to inform and initiate conversations with governments, policyholders, and leaders in communities in every country over time in order to help to fuel their engagement in the areas that need action and to also fuel the accountability for measuring and producing demonstrated results over time. The COVID pandemic, while devastating, has given us an opportunity to pause, reflect, and reinvent how healthcare is delivered for women. And drawing on insights from the index, plus other key resources today, I'm going to keep my further comments fairly short because I've got further detail to share in the next portion of discussion. We would like to provide some suggestions to governments that could be immediately implemented in order to be able to change the awareness of, the access to, and the affordability of good healthcare for women that will improve women's health, that will support healthcare systems, and will drive a faster socioeconomic recovery.
Thanks very much indeed. I think I'd like to pick up on 2 different aspects of the discussion and sort of drive it forward to the end of this panel. One is sort of a major issue of policy initiative that we face. And the second are the particular solution proposals that we wish to focus on. With regard to the major policy initiative, I think we are at a juncture in world history where many people across the socio-political, national, cultural spectrums are asking themselves, what exactly have we done? The climate is going to hell. We are not focused on human health properly. We have dysfunctional political systems. Growth, even in countries where growth is proceeding nicely, you've got large segments of the population that have been left behind. How did we get there? And there are 2 stages in history that should serve as warning and example. In the interwar period, we had a load of problems after World War I, and you alluded to the Spanish flu as just one of them. Many dysfunctional systems, large social tensions arising from these dysfunctions. And then what we required was another world war plus fascism and communism before we found ourselves as a world community again. That is the warning. Then after World War II, we hit another stage in history where it was clear we cannot go on as we did before politically, the world being at war with one another, and economies were devastated and they needed to be built up. Socially, at least in the advanced countries, we were doing well. War helps promote social solidarity. Also, building up after the war gives one a great sense of agency. In terms of nature, the Anthropocene hadn't started, and so that area seemed to be fine. And so we focused on the 2 things that needed fixing. dysfunctional politics, and there we started new multilateral governance regimes, the UN, IMF, World Bank, leading later on to the WTO, WHO, and so on and so forth, helping to promote sovereignty at a higher level than the national level. At the same time, we focused on economics. The economy needed to be built up. So focus on GDP and shareholder value when society and nature seemed to be doing well was just the right thing. Now societies in the emerging and advanced countries not doing well. Nature is not doing well. We face a new set of challenges, certainly as dramatic as the ones that we faced in the interwar period and in the post-war period. And the question that comes up is, are we able to take a major conceptual and political leap at this stage to clean up the dysfunctions that we have, or will we be condemned to mess around until another very serious social and political crisis comes about? And there I'd like to turn to you, Gabriela, because you have been very close to the apex of major international organizations that are focused on precisely that problem. And the question is, what can we do at this stage in history to mobilize forces to have sort of a major conceptual and political breakthrough? Conceptual in moving beyond GDP to well-being, and political to understanding that we need to move beyond merely the nation state to have multi-level governance from the supranational level to the local. That's a really tough one, Gabriela, but there's no person I know
if
who
I
could...
answer that, Dennis, I would be just, I will call my boss the Secretary General of the UN Nations. No, but I completely agree with you, and I have really enjoyed the different aspects of this panel because they are all conducive to try to understand better, which is what we're trying to do here. When changing the metrics, when changing the analytical frameworks, when changing the discourse of what we say, your SASH is just very interesting, investing more on health. I mean, all these things, women or the kind of social cohesion that we never incorporate in our analytical frameworks. So I would say that we are not done from the intellectual construction of a new way of thinking about the world. We have made progress in terms of defining these new elements that have not been captured by very traditional orthodox models. But I'm worried that we should not only focus on metrics because that's super important. That will help us really to put the finger and say, if we continue like that, as we have done with the IPCC or as we have done in the Stern report or the many reports that you have put together that really tells us very concrete elements of why we are not doing what we should be doing. My problem is that this is not an intellectual debate. This is about power and politics. And this is about vested interest. Somebody's gaining from the model. And therefore, would they be willing to let go? And therefore, what I feel is really important is that we get into a political discussion that brings together more at the center the civil society. That's my only hope, because the reality is that we are all very tired about the crisis. Governments have been making these massive investments, and when we see a little bit of growth coming, everybody would say, "Come on, guys, let's just be happy because we are now growing. We have the 80% of the population covered by the vaccine, so let's just cool off because we're tired." And the fact is that how do we keep this momentum? And the momentum will come exactly from what you said, Dennis. It is unsustainable. And the fact is that the level of inequalities that we are seeing, the fragmentation in our societies, as we have also seen, they're gonna take us to more democratic outcomes, and that's the sad thing about it, that democratic outcomes that bring very authoritarian regimes and people completely disenchanted from democracy. And this is the call. The call is, how do we bring together the different parts of our societies to build a more fair and people-centered outcomes. But the fact is that the political economy needs to be addressed, and we need to talk to the policymakers in a way that they would understand what is the outcomes. I will say that bringing the evidence of the kind of impact that our societies will have if we don't change the course will be super important. I have one program here in UNESCO that is the managing of social transformation. And what I've heard around the table is that the societal issues are the ones that need to be taken into account. Not only the individual, not only the GDP, not only the representative agent, but the societal issues. And that's very difficult to measure, but I think it's super important. Very concretely, we need to give responses to those that suffer the most. This is prioritizing the bottom in the income distribution, prioritizing women that really got the bulk from the pandemic, not only being the one fighting the virus, but also taking care of schooling and at home, and then taking up violence. I think this is one thing that we really need to change. If we change the gender agenda, we will be changing everything. But the fact is that we need to put up with these very powerful vested interests that continue to keep the system running as you have it.
Now, you have been at the center of another initiative that addresses exactly that, which is, if we want to prioritize the needs of the neediest, then it is useful to have an infrastructure that allows that. And one big change in technology that has taken place is in the shape of digital infrastructure. And this digital infrastructure institutionalizes inequalities, economic and political and so on, because the digital service providers in one part of the world have all the ownership of the data and power to shape our digital networks. In other parts of the world, governments control these digital networks and can keep themselves in power. And democratizing the digital networks is probably one very powerful way of bringing civil society back on track. I know in the Global Solutions Initiative, we have a working group on humane digital governance, which looks at how the entire digital governance regime can be reformed. And one thing that is relevant for health is spending a lot of time and effort on data commons. Places where people have decided that they wish to share data for a specific purpose and only for that purpose. If these data commons could be secured and data could be used only for the purpose for which people voluntarily relinquish it, then probably we would have made much more progress in assembling health data that would help us in test and trace and so forth in this pandemic. You have at the head of an important ethics of AI initiative. Could you tell us how that ties in with your civil society aspirations?
Well, the fact is that, again, is bringing back this power and decision about how to shape the digital technology to people, to the users. As you say, Dennis, if we believe that the economy and the society has high inequalities, the digital world is just completely out of any proportion, because it's only few countries and few companies that are producing 80%, 70% of the IPRs. It's only 85% of white men doing all the developments of AI, also coming from certain countries. And then data. You have this fantastic, you said the data commons, I see is a fantastic place to start, but the reality is the way we govern data or not govern data, because we're not governing it. The EU has the GDPR, which is a good basis, but the reality that this is international technologies and we cannot have this fragmented way of dealing with it everywhere. I'm glad to see that the Office of the Technology of President Biden has launched a Bill of Rights, because the reality, the real thing here is that the rule of law is not always there when we deal with artificial intelligence. Is not there because you don't have the redressal mechanisms if you're harmed. More and more, these technologies are informing our decisions everywhere. Who gets access to healthcare, who gets access to certain services, who gets access to a loan, who is receiving an interview for a job. And these decisions are made by systems that cannot even explain to themselves as we see it today. So the ethics of artificial intelligence recommendation that I hope will be approved by 193 countries in November at UNESCO is putting this into the court. The question of the rule of law, of having regulatory frameworks that are conducive to really deliver a more inclusive digital space. And we build this with the civil society, as you say. This is super important.
Thanks very much, Gabriela. I would like to turn to a different divide, which is the divide between rich and poor, and turn to you, Alan, who've done a lot of thinking across this divide. Currently in the world, we have a divide between rich and poor nations. The Global Solutions Initiative, which is working together with the World Health Summit, has recently been mandated along with the DIE to provide, to lead the T20, the think tank process of the G7. And the aspiration is to bring that into closer alignment with our advice to the G20. It's extraordinary how the rich and poor countries do not align currently in terms of climate and in terms of health. In terms of health, the poor countries basically have told the rich countries metaphorically, stop hogging all the vaccines and help distribute them more fairly. And the rich countries have shrugged their shoulders. And on climate, there is a similar divide where there are some who wish to make bold steps and others who are saying, we're too poor to think about this, mind your own business. How would you say, Alan, that rich and poor across countries and within countries need to get together to help provide a better background for civil society to have a more equal
Okay,
voice?
well, Dennis, just a reality check for a moment. You know, I speak to a lot of people from low and middle income countries, people who are health ministers and finance ministers and some heads of government. And at the start of this pandemic, there was frustration because they couldn't get the diagnostics or the vaccines or the therapeutics. They couldn't get oxygen, they couldn't get the PPE. And I can tell you now, there's great anger about it. There's real anger. And we have to have a reality check here, that while we're talking about wanting, you know, comprehensive data systems, which I actually very much believe in. I mean, we've got to be able to measure things if we're going to fix it. But while we are having this conversation, there are families, frontline healthcare workers in low and middle income countries who are frightened to go to work because they haven't got the PPE equipment. You've got people who can't get access to oxygen. You can't get access to accurate diagnostics, and they're not getting access to vaccines. Now, if people from the richer countries think that in a week's time, when COP26 meets, that the heads of government from those low and middle income countries are going to be wanting to restructure their economy to try and get zero emissions when their families are dying, it's not today's crisis for those countries. The crisis is the fact that their families are dying. People are frightened to go and work as frontline healthcare workers because they haven't got the equipment. And what really worries me about the debate we're having on health at the moment, and this happened in a discussion I had about 2 weeks ago, we're getting to the point now where the richer nations are thinking, well, we've probably got this under control. It's absolute madness, because there will be another version of COVID-19 coming along in a few weeks' time or a few months' time, or there will be another version of the influenza that will come along. And if we don't get the world vaccinated, if we don't have a mechanism, if we don't have a proper mechanism to deal with global health threats, then it's not going to be another 100 years before we have another pandemic. It could be next year, or it could be the year after. And I just don't think the leaders understand this. And my real worry next week is, well, my big concern is if we get no results out of this weekend's G20, if we don't get the things I talked about earlier, and if we then move into COP26 and you have Britain and America and the OECD and the European Union talking about zero emissions by 2040 or 2050, it's not today's problem for the low and middle income countries. Today's problem is making sure that their children and their families can survive. Now, one thing I'd say to Gabriella, one thing that really just disappointed me, Gabriella, is that these issues are matters of national security. When did the Security Council of the United Nations discuss the global health crisis that we're facing? They discuss Afghanistan, and they discuss geopolitical issues in terms of traditional security. But these crises that we're facing now, whether it is the health crisis or whether it is climate change, these are matters of national security. And we invest in our national security by some countries having nuclear weapons, and in other countries having very sophisticated defense systems, which we hope we never need to use. But we need to be investing in terms of our national security in other systems that we hope we may never have to use, like the ability to have supply chains to develop new therapeutics or diagnostics. And we're just looking at this from the wrong perspective. And Gabriella, you and I have met on a number of occasions. You're a very senior and influential person. The Security Council of the United Nations has got to start discussing the issues that matter to people. And that means they've got to start talking about the global health threat, and they've got to talk about climate change. The final thing I would say to you, Dennis, is that I do not believe from the countries that I've spoken to, the low and middle income countries, that they will give a damn about COP26 next week until the world starts delivering to them the mechanisms to actually save their populations. And the leadership we've got at the moment, frankly, is really very, very poor. And it's a crisis of leadership.
I think there is time for a grand bargain. Rich countries need something from poor countries, and poor countries need something from rich countries. And since these are all global public goods, it would be possible to put this grand bargain together, but it isn't happening, partly because of silo thinking, partly because of nationalisms, and national interest is not the only interest. There's a supranational interest. And nowadays, we can sympathize with people who are saying, we're dying now, we don't care about the climate. But that will lead to deaths in the future. And you're obviously trading off deaths now and deaths in future generations. Therefore, what I'd like to do now is focus on solution proposals. We have a number of proposals that I've taken note of. One is we need to think of how to connect our measurement initiatives on well-being. And if we could come together here to do so in a sort of much more effective way than we have done so, which means basically gathering data, connecting the data with the relevant policymakers, with the relevant business leaders and so forth. Secondly is we need to connect contributions on health as an indicator of urban performance, an indicator of performance more generally. Then there is the suggestion of a Marshall Plan for planetary health. What exactly does that mean? What sort of multi-level governance systems do we require to get this going? If I could just turn to you, Tanya, to give us what you think are the most important steps forwards in terms of concrete solutions now. And then we, together with Global Solutions, together with the World Health Summit, will try to make this more concrete and get back to you and provide further publications in that regard.
Certainly my first recommendation is, you've already put it well, it's around coordinating in order to have common goals. Until we've got a common goal that we're all working towards, we're going to have a lot of very well-placed activities that are perhaps going at odds to each other. So common data, common goals, and unified accountability. I guess that would be my highlight there. In terms of the focus for why I'm here today, which is around women's health, we've got 3 key recommendations, and they're very simple. The first is keep her in school. The second is keep her safe. And the third is to detect deadly diseases early. Now, there's a whole heap of stuff that sits under that. I'm conscious of time. There's a whole heap of data that comes out of the Women's Health Survey, which exemplifies why those 3 things are pivotal. And Gabriella said it very well. Women are the cornerstone of so many activities which are not measurable, that are not valued, and that don't have a GDP, economic indicator attached to it for such as they're the ones who run the homes, they're the ones who care for the sick, they're the ones who care for the elderly. If we were to put a price tag on that, which enables the rest of the working community to be in their offices, to be working because they're at home doing that, then we might just have a different conversation about the importance of women and women's health.
Thanks so much. Tallulah, what would be your most important proposals going forward?
Dennis, I have so much to say.
And only 2 minutes to say it in before we turn to questions from the floor.
I'm going to, well, there were 2 things I wanted to pick up on. One, Alan's point about the crisis of leadership, I would add a crisis of trust. And Tanya's 3 points I would add to that, prevent the preventable, as the 4th. But before I do, I want to take a little step back. Yeah, very quickly, because I do think contextually, particularly when we're dealing with this kind of, thinking about the Marshall Plan and the eco-social contract, we do have to, when we reflect on history, right? So you started off, Dennis, by talking about the ways that we've reacted, First World War and the Second World War. There's a couple of reflections there. Chief amongst that was that we actually also have to recognize that it wasn't, yes, we all came together, but we didn't all come together, right? So this was in the 40s when that was happening. Globally, what was happening was there was still a huge amount of colonization of a whole parts of Africa, Asia, and Latin America going on. And so it wasn't a global effort. It wasn't an equal, we're all in this together, actually. And a lot of the recovery was at a detriment to significant parts of the world, right? both from a health, from an ecological perspective. And we do have to confront that, because that does add extra, when you have to deal with everybody on the planet, it's a lot more complex than, okay, actually let's recover by at the detriment of someone else. And the same applies for gender, right? So we didn't recover in ways that where we thought all of society, we're in this together. There was still a huge gender divide. So I do think it's really critical that and part of the challenge now that we have is that it's no longer socially, thankfully, acceptable to say, okay, let's recover in Europe and let's talk about climate change and pandemic recovery in Europe. And I mean, it's happening, but it's not acceptable to do it at the detriment. Yesterday, I was presenting something of the UNEP reports that show that a lot of the old cars that are being cleaned up in Europe to improve air pollution are being shipped to West Africa and contributing to poor air pollution. That's not acceptable, right? So that was part of how we recovered in the 40s, post Second World War. And I do think that's really critical. So crisis of trust, right? So I would say,
point taken.
Okay. So
your solution proposal.
Yeah. So crisis of trust. So part of the reason I suggested that eco-social contract, because even at the local and global level, we have to tackle the mistrust. So even at the very local level, what we have. So in the UK, we had huge discrepancies in vaccine uptake because there were critical mistrust of the health of science because actually in ways that were rational, right? So we have to confront that, and that's what the eco-social an eco-social contract means. And at a global level, saying, well, how can we tackle? And this is your point, Alan. How can we come together? And I actually do think we have to be thinking ahead as well as dealing with the crisis now. But we have to show a faith, right? Or we have to show good faith to say we're in this together, and we show that by XYZ. So we can't try and create global solidarity around climate action when we are in the middle of another global emergency and we're consciously ignoring the majority world in terms of access to healthcare. It just doesn't. There's nowhere to go. You have to deal with that trust, that crisis of trust, and that requires action.
Is how. How would you promote trust?
So I would start by, okay, there's all of these things I said about the Marshall Plan and the ecosystem, but the first thing is actually just sticking to what we promise, right? So in the COP26, we're talking about a new pledge to support lower middle countries in terms of adaptation. We haven't delivered on the old pledge. So we actually, sometimes action is not something new. It's actually just doing what we said we would do. And I know that's not a sexy, like a brand new thing, but actually, if we say we're going to do something, we build the trust by doing it.
I think it's extremely sexy, if you don't mind my saying this politically incorrect word, because I think we need to devote ourselves to the question, how do we ensure that we keep promises that we have not kept before? That is a problem of politics. How do we ensure that voters are willing to do what we know we ought to do? That, is a problem of legitimacy. That's a problem of motivation. These are problems that need to be solved, and they too have a how question to which we could well apply ourselves. Nicola, you have thought of these how questions. What are your proposals?
I was thinking when Tolu was speaking about this Nigerian writer Chinua Achebe, right? When he published Things Fall Apart in the late 50s, cleverly referred to how much the Great Depression and its impacts sort of triggered a beginning of decolonization. So what I mean here is that the depths and the multiple intersected impacts of one crisis are going far beyond what we might try to control in going in this direction or in this direction. In terms of proposal, it's hard to make proposal that doesn't sound a little bit void or overly ambitious, but I would like to make two. The first one is modest. When you look inside the different mechanisms, bits and pieces, right? Or for example, the G20, something that very, very few people know actually, that there is a wide array of engagement groups representing the civil society, including youth, women, etc. When you look at the communiques this year of the G20 group of Science Academy, the G20 group of Social Science and Humanities Academy, the G20 group of the businesses, etc., there is a converging need to assess these questions of social infrastructure, political leverage investments, urbanization. So there's something to do here, right? Hence my proposal of a G20 pact, which I introduced earlier. The other issue is different, broader, and would be about thinking what we can do still with the 2030 agenda of development, right? And somehow what is missing is something that could be like a development security council. All right, so here would be my two proposals.
Thank you very much. I think this is a good time to take questions from the floor, if there are any, please. A microphone will be handed to you. And if you can keep your questions to under 20 seconds, that will allow us to respond.
Can you look at the camera and then take the mask? Yes. Hi, thank you very much. The panel has been extremely brilliant on discussing very important issues. I would like to bring the perspective from the developing world. I just didn't hear much about the topic of taxation. It doesn't matter if we're speaking about a Marshall Plan. There are differences that are not only across countries, but within the same country. And we still see that the European Union does not want to introduce comprehensive taxation for extremely wealthy individuals that we now know that hide their wealth in fiscal paradises. What's the role for that?
Thanks very much. Would anyone on the panel, including Gabriela, want to say something about taxation?
Well, I would just say that he is right, because if we want to rebuild the social contract and improve the social protection systems with investments on health and education, I mean, you need where the money is coming from. I would say that, yes, I would say that it's very important that we tax wealth. And we know it can be done, even though the economic, more traditional theory is always full of very good arguments of why not. But I think it's unavoidable. And I think that this will be one of the aspects of what Lule was saying about recovering trust, because you will be being fair, which is something that people are not feeling that the system is fair, and therefore they don't trust. But I just want to say that with my old hat at the OECD, we made amazing progress. I can tell you that with the automatic exchange of information was a revolution. And therefore now these evaders cannot hide from the tax men or women. And this breakthrough in the G20 just 3 weeks ago to charge 15 tax basic rate for multinationals that were actually not paying their due fare of taxes. So I feel that that will be improving. But then it's not only the question of raising funds, it's how you invest them. I will stop paying for fossil fuels. It's huge, the amount of money that goes into that could go to something else. And in some countries, you pay more for fossil fuels or for energy consumption than what you do for health. So let's just get the priorities right.
Thanks very much indeed. Any other questions? All the way back. Yes.
Thank you very much. I'll be brief. Preventing future pandemics will cost much less. So tackling the spillover effect, ending factory farming, ending wildlife trade, shouldn't this be part of the conversation?
Thanks very much. Who would like to reply to that?
I agree completely with that. I mean, this is why you know, we've proposed the idea of the global threats board. And the role of that board should be the equivalent of the financial stability board that was set up after the economic crisis. And, you know, we haven't had a systemic collapse in our financial system because those finance ministers and central bank governors meet in the financial stability board. We need a global threats board that is not just health ministers. It's got to be the heads of government from G20, it needs to be the IMF, the World Bank, the World Health Organization, but they've got to commit to the resources. And that's why we need the financing mechanism, which they created for 2008 and 2009. And there's no way around this. You need the Global Threats Board and you need the financing mechanism. Otherwise, we're going to be in the same situation in a year's time or 5 years' time or 10 years' time. And the cost, as you've just said, to mitigate these things is massively more than the preventative measures that need to be brought in now.
And we need to simply address this issue of a higher level of sovereignty, whether it be a global threats board or whether it be a global carbon tax, global wealth tax. There is a higher level of sovereignty that is required in order to make all nations better off. Tallulah,
just to add to that very briefly, I completely agree, preventing the preventable. And then at another level, thinking about the urbanization, right? So the nature of urbanization, the fastest growing countries, urbanizing spaces at the moment are growing in ways that disrupt ecology, right? And so, but we're not thinking about, and this is part of that kind of thinking about centering planetary health into urbanization. So yes, it's about healthy environments, but it's also thinking about how cities grow and making sure that we're not disrupting ecology, which also has benefits in terms of biodiversity loss and the rest of that. So it's really this kind of systems approach of thinking about, and that's the opportunity actually, particularly in spaces that are growing most rapidly, to say we can actually protect health because our cities are actually changing. And there's an opportunity to protect the ecology and to protect human health as one.
this has been an extremely fruitful panel. And I'd like to take this opportunity not only to thank the panelists, but also to warn them that we will be continuing to connect with you in order to give more punch and power to your initiatives and to help disseminate the initiatives that you yourselves are initiating. Thank you so much for participating, and look forward to our next round of exchange. And if I could hear a round of applause from the audience, that would be most welcome.